Hospitals in Texas are now required to ask patients for their citizenship status. It's part of a new executive order from Governor Greg Abbott that took effect this month. Tonight, KLTV7's Naomi Sanchez explains what the new requirement is meant to do and why some people find it concerning.
As of November 1st, emergency rooms and acute care facilities across Texas that accept Medicaid funding and CHIP are required to ask for patients' immigration status.
The order is meant to collect information about the number of people in Texas and the amount of money spent on medical care for undocumented people.
And beginning next year, hospitals will be reporting this information on a quarterly basis to Health and Human Services. And from there,
they report it to the governor's office, and the governor's office goes to the federal government and says, look how much money we're spending on undocumented people's health care. The federal government should pay Texas for that care.
It is unclear if such a reimbursement would be possible in this way. Additionally, Senior Administrator of Policy and Advocacy with the Children's Defense Fund, Trudy Taylor-Smith, says the data collected would not take into account out-of-pocket money undocumented immigrants do pay for their care.
So I think in part, this order is based on the faulty assumption that the state is paying for all care that undocumented people receive, and that undocumented people are not contributing at all to state funds.
Another concern is the effect the executive order could have on the community's trust in health care.
This executive order does run the risk of endangering the health and safety of countless Texas children and their families.
According to data by the American Immigration Council, Texas has more than 1 million U.S. citizen children with at least one undocumented family member.
It makes sense that people would be scared about that, right? Like, there is a paper somewhere that has your name on it, that has your immigration status on it, which is exactly, again, like the chilling effect that specific question instills in people.
In efforts to prevent immigrants and their families from avoiding medical care, experts stress the order does not require anyone, regardless of legal status, to answer.
The order requires hospitals to ask for information about whether someone is lawfully present or not, but the order doesn't require patients to respond.
Under the order, patient care will and should not change regardless of participation. Naomi Sanchez, KLTV7 News.
And that order does not outline how every hospital must abide. We did reach out to UT Health and Christus for interviews, but instead we received statements confirming their compliance with this order. To read those statements in full, all you have to do is scan the QR code at the bottom of your screen or go to kltv.com and click